oration and the treatment. The scientists are learning more and more on the form in which several parts of our mind are connected to different physiological processes from our body. Direct connections between the curative brain center of our will and our faith and systems exist. We know that the brain communicates continuous and unconsciously with the immunological system, the cardiovascular one and other important organs of the body, by means of the liberation of hormones and other substances of the nervous cells. An intricate system of the nerves of the brain extends directly through the spine to the lymphatic nodules, the spleen and the marrow, primary origin and maintenance of the immune system. The brain also can communicate with the immunological cells of the blood by means of hormones and other proteins. As well, the immunological cells send chemical messages of return to the brain, completing an intricado biofeedback. The brain also sends messages to the spine to accelerate or to diminish the transmission of painful impulses. Therefore, it seems evident that the anatomical ways exist so that the brain could direct the impact of the experience of the pain and the fast recovery infections and other diseases, even of the healing after the surgery or accidents. These connections with the brain and the mind must exist for some reason. There is abundant scientific information in favor of that. The fundamental reason is the power to connect our psychological life, social and spiritual with our physical body, so that they work united like a whole. When people who believe they have been bewitched visit a healer, they are frequently given a potion of ayahuasca to help them see who it is that has caused their illness. As with other hallucinogenic drugs, an unordinary state of reality fills the hours of drug experience and is one that is unlike any other than most men or women have ever had. The possibility suggests itself that the plant operates merely as a placebo, an inactive or inert drug given merely to produce a satisfying effect upon the patient. Is it possible that faith in the curative power of the drug itself is enough to cure? I think we have to dismiss this possibility, which may enter into a discussion of LSD therapy in the United States and Canada. Their insights into personal problems have often been examined by an analyst who guides the session. Ayahuasca is not used to obtain verbal insight, and external rather than internal forces are viewed as responsible for disease. Man is in effect absolved from any responsibility, especially in cases of saladira and situations involving interpersonal stress. The impact of such external forces is most clearly seen. Moreover, little of the biochemical effects of ayahuasca's healing properties are known. From my own personal experience, I would guess that strong hallucinogens like ayahuasca manage to relieve feelings of anxiety and tension which can build up to intolerable levels. Yet, although one would hesitate to call the purge a healing hallucinogen, it is possible that future evidence may point up more clearly the curative potential of the drug from a pharmacological point of view. Nonetheless, both healer and patient are crucially concerned with identifying the nature of the illness, which in psychosomatic disorders may be very generalized pains and aches throughout the body. When people known to the patient or even total strangers appear in his visions, a skilled healer will attribute his patient's illness to such apparitions. Generalized, free-floating anxiety which immobilizes can then be changed into straightforward fear and placed squarely on the shoulders of the acknowledged evil person or spirit. A healer is especially successful in those cases when his patient believes him to be omnipotent and if an aura of personal success surrounds him. Thus, the healer may be able to relieve his patient's symptoms quickly and dramatically, when the patient believes the healer is powerful enough to counteract the evil magic directed against himself. People rarely focus upon ayahuasca by itself as a curative agent. The hallucinogen is a means toward an end, a way in which healing can begin. Special diets, rituals, orations, particular spells, and counter magic are the ways in which healing takes place. Reassurance, suggestion, counseling, as well as other techniques to be discussed shortly, are all part of the cure, but the drug's role throughout is strongly diagnostic and revelatory.